You're listening to the Turn Autism Around podcast, episode number 147. Today, I have two guests, including world-renowned autism expert, Dr. Temple Grandin, who is also in podcast number 117. Dr. Grandin and the co-author, Dr. Debra Moore, authored this book, Navigating Autism, 9 Mindsets for Helping Kids on the Spectrum. And I am interviewing both Temple and Debra on the show today to discuss the book and the 9 mindsets needed. Dr. Temple Grandin is one of the most respected experts in the field of autism and animal behavior and livestock handling. She's an internationally known best-selling author and a professor of animal science at Colorado State University. Temple also wrote a beautiful foreword for my book, Turn Autism Around, an action guide for parents of young children with early signs of autism, which was published in 2021. Dr. Debra Moore is a psychologist with over 3 decades of experience working with children, teens, and adults on the spectrum. They do a great job in writing their book, and it's a very interesting interview today with Dr. Temple Grandin and Dr. Debra Moore. So let's get to that episode. Okay, so thank you so much, Temple and Debra, for joining me. It's going to be a real treat to have you both on the show. So thanks again for joining us.
Thanks for having us.
It's great to be here.
Yeah, so we'll start with Temple. You've been just a pioneer in the field. You wrote the foreword for my new book, Turn Autism Around. I've met you in person. I've seen you speak. You've just, I've read your books, saw the movie that depicted your life on HBO. You've just been such a pioneer. So what made you want to write yet another book? I don't know how many books you've written, but it's been a ton. So what made you want to write this book called Navigating Autism, 9 Mindsets for Helping Kids on the Spectrum?
Well, one of the things is the publisher approached us. That was one of the reasons.
Okay. And how does this book differ than your other books?
Well, I think this book is more aimed at a parent as a newly diagnosed child that really upset about that. And one of Debra's terminologies that I really like is label locking. You need to look at the whole child. It's not just the label. And I even see MDs when the kid has something medically wrong with them, just say, well, it's just autism, that he's behaving badly. When in actuality, he had he's behaving badly because he had acid reflux that hurt like a whole lot, or some other medical problem that should have been treated. So even the regular medical doctors have a tendency to label lock and not treat a regular medical problem that would cause pain that anybody could have.
Yeah. And I know we're gonna, that is one of the mindsets, the whole medical discussion, which I am all about. Love that topic as a registered nurse and a behavior analyst and a mom. I'm all about the medical thing. But let's hold off on that thought. So Debra, this I think is your second book or project with Temple. Is that right?
That's right.
Yeah. So how was it working with Temple the first time and in this time? And must have been a real honor.
It's an honor and it's a blast. I think, for this book, we wanted to take a step back and not talk about just 1 or 2 specifics or 1 or 2 treatment strategies, but we wanted to really speak to everybody, speak to parents, speak to clinicians, speak to educators, and no matter what profession they're coming from and no matter what intervention they might be using, these mindsets are sort of an umbrella for all of those. And in fact, I had someone listening to me speak about the books, and they were a teacher, and they said, gosh, these mindsets really apply to all kids.
Mhm.
And I think that's really true. They apply to all people. We talk specifically about how they apply to kids on the spectrum, but they can be used for all of us. We just want to bring out the potential in every kid. And that's not happening for a lot of our autistic kids. And that gets Temple and I think I could speak for Temple a little bit, that gets us upset. That's kind of our mission, to let kids and adults be the best person they can be, and never to underestimate them.
Yeah, I love that. And, I have a very similar philosophy. I'm always like, let's step back, look at the whole forest. Let's not get too close. The spectrum is so huge, and there is so much infighting and controversy. And parents of newly diagnosed kids or kids showing signs with autism that are on horrendous wait lists, they enter and they're like, okay, ABA is, the most scientifically, proven therapy, and insurance is going to pay. And then they hear ABA is abuse, and ABA, they're already dealing with so much. Like you said, Temple, the parents are upset. And then you have people online that say, what are you upset? Stop being upset. Autism is a gift. And it's like, you have a 2-year-old, who's not talking, not potty trained. So how do you respond to people like that, Temple?
Well, this is the problem. I see when the kids are real little, I looked really horrible when I was 2.5, 3 years old. But if you get good early intervention, then they kind of move into 3 categories. The fully verbal. Elon Musk recently came out that he was on the autism spectrum. Yeah. I always thought he was autistic, but I couldn't say it until he told Saturday Night Live.
Right.
At the other end of the spectrum, you might have someone who has epilepsy, nonverbal, and may even have some movement problems along with the autism. So you have this huge spectrum that's given the same name. Now, as a visual thinker, that doesn't make much sense to me because they're so different. But the problem is when the kid is 3, the things you do with a 3-year-old are the same. And then if you have good treatment done, you get them talking, and we've got to get on these kids early. I do a lot of talks in very low income areas with no services, and I get asked, what do we do if there's no services? You can't wait 2 years to get a diagnosis. If you've got a 2-year-old that's not talking, you got to work with them now. Right now.
Yep.
Like go to the church and get some grandmother volunteers.
Yeah.
Because a mom can't do it all themselves.
Yeah.
And of course, I like for that, like my Way I See It book, which just are real practical how-to. We're navigating autism. I think where it fits in is we got the mom, had a young kid diagnosed. She's really upset right now. This book will kind of put it in perspective, where my Way I See It book is sort of more how to. When you actually got to work with the kid, what do you do with them? So that's kind of 2 different things.
Yeah. Yeah. And I liked what you said, Debra, about like, you can use this book no matter what kind of therapy you're doing. If you're doing therapy X, if you're doing ABA, if you're doing floor time, it doesn't matter. You still want to be positive. You want to do a whole child evaluation. You want to, support the parents. So that is one of the big mindsets or big ideas in the book, is that you're going to look at evaluating the whole child. So can you speak a little bit on that?
Well, let's look for me. When I was 3, I didn't have any art ability. But by the time I got to be maybe 2nd grade, 3rd grade, that's when my art ability started to show up. Or maybe another kid might have math ability. And then you want to work on developing that strength. Now, right now, I want to differentiate between a strength and an interest. Something like visual thinking. I'm an object visualizer who thinks in pictures. You can watch that on the HBO movie Temple Grandin. That shows it perfectly.
Love that.
Visual thinking would be a skill, where an interest in horses, that's an interest. Or an ability in math, that's an ability. An interest in cars, that's an interest.
Okay.
I'm finding a lot of parents are mixing up those 2 things. And then, of course, the word thinker is good with words.
Okay.
They might be interested in medieval history. There's a tendency for a lot of the verbal autistic thinkers to really like history, which would be an interest.
Okay. I like that. How about you, Debra? What can
Yeah,
you add
when
about the child?
When you're doing an evaluation, I think one of the things to remember is a lot of the therapists are not visual thinkers like Temple is. A lot of us tend to be verbal thinkers. We also tend to be more on the social end of the continuum. And so we have to remember who we're working with and make adjustments. So again, it's that idea that there are general mindsets, but each child is unique. Each child is individual. So each evaluation should be individual. And we're often taught, no matter what our field is, whether it's physical therapy or occupational therapy or clinical social work or psychology or psychiatry, we're often taught a standard one size fits all evaluation for autism.
Hmm.
And autism is just too broad, and it's very deficit based, our medical approach to autism. So when we do an evaluation or when we do a treatment or just when we interact with a kid, we need to get out of that model. We need to get out of that deficit model, and we need to intentionally try to tease out strengths. And then, and you do that in an evaluation by sort of coloring outside the lines sometimes and giving that child, like a visual thinker like Temple, an opportunity, for instance, to do some drawing in an evaluation. It's going to get them more motivated. Their attention's going to sustain better. They're going to perform at their higher level. And that's what you want to get. You want to
Or
get
you might have another kid who's a mathematics kid. And one of the mistakes that's made with that kid is you keep making him do baby boring math, and then you wonder why he's a behavior problem. And oftentimes math and music goes together, because in one of my books, The Autistic Brain, I discuss the science behind the different kinds of minds. There's actual science that shows that you can have object visualizers like me. You can have the visual spatial mathematics or a word thinker. There's science behind that. And there's more new research that backs that up. And there's a tendency to just look at deficits. And there's an old term I absolutely despise called splinter skills, where they would, well, they would look at the math ability or the drawing ability as kind of a skill is really not all that important. You call something a splinter, that wouldn't be very important.
it
But
makes
for
it
me,
secondary. And that might be a primary focus. You know, Temple, some of your skills could be called splinter skills, but they've been the primary focus of your life and have contributed to our society in amazing ways.
well,
They're not-
using my skills in visual thinking has helped me in my work with livestock. Now, I've got some deficits. I can't do algebra. I've never passed an algebra class. And I got out of it due to a fluke in the college system in '67. But I'm concerned something like an algebra requirements for keeping a kid out of an auto mechanics class, because visual thinkers are often good at mechanics. And I worked with all kinds of talented tradespeople that had maybe 20 patents that were visual thinkers. And they were not the good students. And there's a tendency to, think that kind of thinking is not so valuable. Let me tell you.
So when we're looking at young children with early signs of autism or just diagnosed, I do have another podcast. I actually have Temple's podcast. I interviewed her. That's 117. We can link that in the show notes. And also I have a whole podcast on assessment, and I have a one-page, very easy form that looks at, because like when Temple said, a 3-year-old may not show ability in art.
You won't see it in a 3-year-old. I get asked all the time.
Right.
If you can tell what kind of thinker a 3-year-old is. There's a few exceptions, but usually you cannot.
Right.
Mine did not show up until more like second and third grade.
Right.
That'd be 7 and 8. I can remember a Valentine I painted when I was 5, and it was just little kids scribble art, and I can remember doing it.
Yeah. Yeah.
There was nothing wonderful about it.
Yeah. So with young children, that's why I think this form is really good, because it looks at safety issues. Are they running out in front of cars? Are they, it looks at, are they on medications? Do they have a diagnosis? Do they have allergies? Are they on a special diet? Do they still use a bottle or a pacifier, which could affect talking? And then we get into talking and following directions and socialization. It's just one page that can be done very quickly. We can link that in the show notes as well. But
well, the other big problem is the amount of medication kids are on. It is just awful.
Yeah.
I mean, you might have a young kid on 5 or 6 meds, and then when you talk to the parents, you find out no thought went into any of these prescriptions. They were just writing them. And now I just heard a horror story. This is a guy that's in his teens now. They put him on one drug and he's now monstrously overweight, got diabetes. Then they gave him another drug and it messed up his ability to do math. And he should have stopped taking it immediately.
Yeah.
But the insurance company said they wouldn't pay for a different drug. So it wrecked his math ability. So now he's fat and diabetic. This is 2 days ago at a meeting.
Wow.
I ran into this. This is now. And the kid was on Medicaid.
Yeah.
Just horrible.
And as a
And
parent,
he's on a better drug now. And I said, you need to just get the algebra book out and keep trying, like rehabbing a stroke patient. He said it was slowly coming back.
wow.
But this is just a horror story I just heard. They come up to me afterwards. I hugged him at the end. He was crying. And I said, you just got to keep working and hopefully you can get the algebra back.
Yeah. Yeah. And as a parent of a child who, well, now he's an adult, but when he was little, you know, when you try a med, if and when you try a med and you have a child that can't communicate efficiently, you can't tell if they're having side effects. And so, so I did a podcast interview with Lucas's psychiatrist, who was also a dad of a young man with autism. And we'll link that in the show notes. That's one of my favorite episodes because we talk about, like what you're saying, Temple, the overuse of medications and how to tell. There is a really good testing now available to show that, like for Lucas, many of these meds would cause obesity. And
This is horrible. This guy was really obese. I mean, I can't be against meds because in Thinking in Pictures, I described my experiences with taking one little antidepressant. That's one little drug.
Which worked.
Yes, it worked. And if you're interested in that, and I took it as a young adult, not as a child. Way too many drugs given out to kids. And if you're interested, and I recommend reading the book because I don't want any misunderstanding about meds. I went to a very good veterinary conference on medications for dogs.
Okay.
I use a lot of Prozac and Trazodone. And it was very cautious. You try one thing at a time. You don't use meds as dog straitjackets, and they use that term. But it was trying one thing at a time. It does not replace taking your dog out, exercising it, and playing with it. It was a very good presentation. I think a bunch of MDs need to listen to that presentation. Very careful approach, trying one thing at a time. And no, if your dog's locked up in the house all day and crazy, you better do something about that. You don't just treat that with meds.
Yeah.
It's the same principle, same exact principle.
Oh, absolutely. And one of your mindsets is no medical conditions associated with autism. So in addition to being careful and not, just accepting medications for a young child and, and really working with your practitioners to try to get strategies in place, so that you can tell if it's working. What's that?
There tends to be a lot more physical problems like gastrointestinal issues, allergies tend to be more common, food sensitivities. There are some things do tend to be more common in autism, and those need to be treated.
Yep.
When I'm talking about meds, I'm talking psychiatric meds. I'm not talking about treating acid reflux.
Okay, so let's talk about the difference. Okay, so mindset 4 is the medical conditions associated with autism. This is in your book now.
And that's the medical conditions that have nothing to do with autism.
Okay, so
but people that have autism are more likely to have gastrointestinal issues.
Absolutely.
That's well documented in the literature. I have skin problems. That's another thing. In fact, a genomic analysis done on me showed my skin problems. It showed why I'm missing all these teeth. Anxiety problems. Now, when it came to the autism genes, it's so embedded in the same genes that make the brain big that you're not going to find them. I had a few risk genes. That's all. You won't find them. They're the same genes that make the brain big. Give us human beings a huge brain.
So then the mindset 5 is know these psychiatric conditions associated with autism. And so in my situation, we were, early on, we were trying to treat like sleep problems with medications. We were trying to treat agitation with medications. And, so a lot of times it is kind of all tangled up. And in fact, Lucas is on a cardiac med, which really has helped him in terms of his autonomic nervous system dysfunction to settle him down. So it is all
Well, and that cardiac med's a much safer med. The meds that have the worst side effects are the antipsychotics, things like risperidol, Abilify. They have the worst side effects.
Yeah.
And the cardiac med is much, much lower side effects. The other thing, exercise is very important for me. A lot of these kids aren't getting enough exercise. And then in our previous book, The Loving Push, one of the big things we emphasized was getting the kids off all the electronics and the video games. And the research is very clear. Autistic kids get more addicted to video games than regular kids. We've got to get this under control. And Silicon Valley parents out in Silicon Valley, they restrict the video games. They know how addictive they've made them.
That's interesting. And that the latest book about push, Debra, you were involved with that book as well.
No.
Yes, The Loving Push.
The Loving Push.
And we had a big chapter in there on the whole video game addiction problem. And that book came out a little while ago, but all the new research coming out is bad. In fact, in China right now, they're very concerned about kids getting addicted to video games. And after they played it for an hour, they're kicking them off because they don't want their future people addicted to video games.
Yeah. So Debra, what can you add in terms of the different mindsets? We covered the evaluation of the whole child. Of course, we're just skimming these mindsets. So you need to read the book, Navigating Autism. I haven't read the whole thing yet, but it is very interesting, the parts I have read. What about the overlap between the medical conditions and the psychiatric conditions and just trying to sort through that? Are the chapters heavy in reference material, or is it just like big ideas to think about?
There's three parts. One is reference materials, literature, study results. The other is questionnaires for parents or clinicians, kind of checklists to go through to help guide decision making. And the other is real or hypothetical examples so that you can really see how it plays out with different children.
Okay.
So
well, you've got a lot of anxiety, depression, and obsessive compulsive disorder is often they call it comorbid. I just hate that term.
Really?
Comorbid with autism.
Sounds deadly.
That.
Yeah, and what you were saying is so true. It's never simple. It's never one thing clear cut. That's not the way the body works, number one. And autism surely doesn't work that way. So you really do need to tease things out. And that's another part of the book that we repeat, is that team members need to be communicating with each other, because depending upon your profession, you're going to see through a certain filter, a certain lens, and you're going to overemphasize that. So if you're the psychiatrist, you're going to overemphasize medicine. And so we've got to communicate so that everybody's input goes into the child and we don't get skewed in one direction, because it is complex. It is made up of lots of ingredients, and there's not just going to be one medical condition or one psychiatric condition associated with a child. In 99% of the cases, it's going to be more than one.
Yeah.
Well, my common ones are depression, OCD, and anxiety, because my anxiety's been controlled for the last 40 years with just one little medication. But I kind of, in horror, think about what if I'd been born 20 years later, all the drugs I could have been on that could have messed up my thinking. There's a case that I just heard about, and they put them on an antipsychotic. I think we'll leave out the names of the drugs because I'm just trashing the whole thing. But the first one made him fat and diabetic, and the second one wrecked his ability to do math. That's real serious. And this is a guy late teens, and this is going on right now. This was 2 days ago.
You do have in the book, page 65, a word of caution about standardized testing. And I know I've done a video blog on IQ and autism. My son does have IQ below 70, which, is what it is. I mean, he needs 24/7 supervision, and in the end, adding that diagnosis of intellectual disability actually provided in the past more care. Now it's getting a little bit, but you do write about a caution. And I know there's a lot of debate whether you should even test kids with autism in terms of IQ and other standardized testing.
Well, if you're going to test them, you need to be aware of some things. You need to be aware of their verbal abilities and use appropriate instruments. You need to be aware of sensory environmental factors that may be affecting their performance. You need to be aware of what happened the morning of the testing evaluation. Are they really in a state that they're ready to be their best self? And those things tend to not get as much attention as I would like to see them get. So that's why we had a whole chapter on evaluation.
Yeah. And I did skim through that, and it's very good. And it while my like 1-page assessment is really quick and easy, you do provide like a lot of things to think about, like who brought the child in and how are they describing the situation, and how is the child, interacting with the environment and things like that. That, I mean, you can tell that you have 3 decades of psychology and psychologist background, Debra, that you really bring that into the book to think about, like really a lot more detail than most books. And I feel like the online space and in the autism community, especially, there's a lot of squabbles and fighting and differences of opinion.
Well, you get into this whole mess with ABA right now. And I can understand the old advocates that are on the spectrum, people my age, people maybe 50, maybe 45, hating it because they were subjected to some really awful ABA. Where they were driven to sensory overload. But what worries me is, I was just on this last trip, is you've got young advocates, maybe in the early 20s, going anti-ABA, and they don't even know what they're talking about.
Right.
And this is the problem. They get on social media. They haven't been out visiting places. I went to a very good ABA place in Iowa just a few days ago. Saw a fabulous teacher there who was on the spectrum. Man, he knew how to work with these kids. He knew how to work with them.
Yeah.
I could just see it.
Yeah, I did the Turn Autism Around approach is ABA, but it's also verbal behavior, my experiences as a nurse, as a mom, as a BCBA. So I did a podcast interview on 4 myths and truths about ABA. We'll put that in the show notes. I just did another podcast interview with Tamika Meadows, all about how to spot bad ABA and how to get good ABA. And like Debra said, I mean, ABA is the science of changing behavior. Whether or not you love ABA, hate ABA, or think you're using ABA, ABA is operating all around you, even if you're using something that you're considering something not ABA.
Well, it's ABA that if you speed, the police give you a speed. Yep. That's ABA.
Right. That's one of the principles, but there is child-friendly, positive ABA, and that's what I do. That's what the Turn Autism Around podcast is all about. So we just need to keep, saying the same thing. We're all looking, whether it's your book, my book, any information I'm providing here on this podcast, we're looking to help people move in a positive direction, to evaluate the whole child, to make a plan, to support parents whenever possible, so that everybody can be as safe, as independent, and as happy as possible throughout their lives.
Well, the other thing
never goes down, never stays.
The other thing that has to be recognized in ABA is sensory issues.
Yep.
And some of the old ABA just ignored sensory issues and drove people into painful sensory overload. So I always ask parents, is your child improving? I'm talking a little kid here, a 3-year-old, getting more speech, getting more turn taking, getting more skills like dressing and using utensils. And that's good. The other thing is your kid ought to like going to therapy. And if your kid hates going to therapy, something is really wrong.
We want the kids to be running to the table, or at least walking eagerly to learn. We don't call it work. It's learning time. It's fun time. It's play time. We want kids to, I'm glad you brought that up, Temple. We want kids to be happy. Not happy when they're 10, happy all along, the whole time. And sure, a child may cry here or there, but I want happy. I don't want crying. If they're crying, if they're biting, if they're hitting, that's not autism. That is lack of the right interventions.
Well, the thing is a good teacher knows how to push. Like one kid, you can push harder than another one, depending upon how sensory sensitive they are. What's happening now is you've got young advocates that are just jumping on a bandwagon to bash ABA. They don't even know what's going on. The old advocates, I can fully understand where they're coming from because they were subjected to bad ABA.
Yeah, it is a challenge, but just like everything else, we'll get through it. And I think people like you, Debra, and of course you, Temple, for many decades have been pioneering the way for positive treatment, no matter where you fall on the spectrum, what the age is, doesn't matter. We're just trying to get to a better place, whatever that means, and turn things around to make the person more independent and happy.
Good, I'm glad.
Yeah, that's great. How has the pandemic impacted the autism community? We've done a few video blogs specifically on the pandemic and how to get kids to wear masks. I just did a video blog on that. We can link, but I know it's changed everybody's life. Really, any thoughts on the pandemic? And did you put the pandemic in your book? Because I know I did. I did not talk about the pandemic in my book because I was writing it. Were you writing it during the pandemic too?
We did. We had a very wise publisher who asked for a whole separate section, and I'm
Okay.
really glad that she did. The pandemic has had a significant negative impact on a lot of autistic kids and their families. Their parents are stressed out. Resources aren't there. Therapists can't come into the home the way they used to. So I think, unfortunately, there's going to be a lot of catch up that needs to be played as things return to normal, hopefully, next year or whenever. And there are kids who are going to have regressed. No, the more that a family had the resources to be able to keep that kid involved or to find some alternative activities, even if they weren't structured and formal, then the more that kid would be able to keep developing. But I think some kids just kind of stalled out.
Well, you can't work with little kids over Zoom. That just doesn't work.
Yeah.
The thing that I found that helped me is make sure I got up every morning, showered and dressed for work by 7. That helps a lot.
Okay.
Not laying around in jammies. Absolutely not.
Or dressed from the top up, which many of us.
Well, I have to say that my best pair of pants are not on right now, but I do have pants on. And they're not the things I sleep in, but I'll admit they're not the best ones. I'm going to wear much better ones when I teach my class at school tomorrow.
When you're in person. Yes, definitely.
So I've worn some shoes that were really pretty bad.
Yeah.
You have shoes on. That's better than
Yes,
me.
I actually do. No, I've always, when I say get dressed, yes, I'll have shoes on. They may be old ones, but I have them on. Again, it's not the stuff I sleep in. And I think that's important.
Yeah.
I don't wear my best stuff on the bottom half, only on the top half.
I think a lot of parents are at least getting, like parents of young children, Temple, where I agree, it's really hard to, it's impossible to do Zoom just with a little 2 or 3.
You can't do Zoom with little kids. That does not work.
But you can do Zoom if you train the parents over Zoom.
That's right.
And you can do Zoom and you can watch them. And a lot of parents.
You can do that.
My
one of the things is a
course
problem.
for doing this, and they made all kinds of progress, because parents are learning through books like yours and courses, and parents are being empowered that, just because the pandemic really highlighted the need, no matter what the age, the parent is the one at home holding the stuff together as much as
one
possible.
of the problems is, you've got single moms, you've got low income moms. They just can't do it all themselves.
Mm-hmm.
And this is where you get a grandmother to come in, you set up kind of a quarantine pod. And and get somebody to come in and work with the kid, and somebody who's going to be careful in terms of, picking up COVID and bringing it in. But a lot of these moms have got to get some help.
Yeah.
They've just got to. It's just too much.
Yeah. And two podcasts I think we should put in the show notes. One is with Grandma Diane, who, she joined my course before COVID, but she really 3 days a week, she really turned things around. And then also with Michelle C., who got the diagnosis right before COVID hit. Everything was canceled. Not even a Zoom call was offered, and made all kinds of progress on her own. So we can link those in the show notes. But parents, I think, your book does a good job. I haven't obviously read the whole thing, but does a good job of just, you can do it no matter, like Temple said, if you're a single mom or you come from a family without resources, there are ways to learn how to put one foot in front of the other and to get
what I
help.
tell the families where there's no formal resources is we got to work on things in the neighborhood, like getting some grandmother volunteers to come in and work with a young child. Okay, got older kids, maybe have a class in fixing lawnmowers or an art class.
Temple, you have some rules for a successful adulthood. What are the rules?
One of the biggest mistakes I'm seeing, we're doing a good job with little kids, a lot of little kids. But then when they get to be the teenage years, we're not doing a good job in many cases on life skills. Things like shopping, things like learning how to work. I see too many moms that don't want to let go and have their kid learn how to use money, learn how to shop, learn how to drive. And the biggest one is not learning how to work. They need to start learning working skills, chores when they're little, volunteer jobs when they're like 11 to replace the paper routes, and then it's instant illegal real jobs. And we need to make sure they're not shoved into too much multitasking, they're not, or too chaotic a job. And that's what we need to be doing. We're not doing it anywhere near enough on the work front.
Mm-hmm. Yeah. So
Just wait for this lawnmower to go by. You can edit it out.
Is that on your end?
Yeah, it is on my end, and doesn't happen that often, but this is the day they, every 10 days they mow the lawn.
All the time. So the book is Navigating Autism. It just came out September of 2021. But before I let you go, so you can get this on Amazon or wherever books are sold. And before I let you guys go, I like to end my podcast the same way with guests. Part of my podcast goals are not to just help the kids, but also to help parents and professionals be less stressed and lead happier lives. So Debra, we'll start with you. Do you have any stress management tips or self-care strategies that you use?
Don't try to be a perfectionist. The concept does not exist. Learn from your mistakes, be grateful for them, and take time to enjoy the really simple things.
Well, that's right. And my mother was very important when I was a little kid, but she had some activities where she could do things she wanted to do. She did a lot of semi-professional theater when I was young. And that was her time to just get out with her grown-up friends and do something she wanted to do. I think it's important for parents to have some things where they can, go to a movie, go to dinner. See, by the time I was 5 and 6, we could do stuff like go out for dinner or go to a movie. But then you've got kids that are much more severe where normal activities are just impossible.
Mm-hmm.
You see, that's really, a lot of parents get really stressed out, and you have a kid that you can't take them to a restaurant.
Right. So your recommendation is the parents need their own outlets too.
They need some time off from some of this. Otherwise, they're going to get so stressed.
Mm-hmm.
I remember, you see, my mind thinks in specific examples. And I remember going to I gave a talk at a big church, and they had one night where parents could get respite. And one set of parents just, sat in their car in the parking lot and listened to music. They just were completely stressed out.
Mm-hmm.
And the kid, they had like 2 hours now or 3 hours where they could just chill. I needed that.
Yeah, that's great. That's why, we do these podcasts to highlight that the spectrum is very wide. There's no perfect answer. There's no perfectionism. We're just trying to help each child and each family and each
Well,
parent and professional.
Well, that's saying
They're full-
perfection is the enemy of good.
Yeah. Yeah. And to just strive for happiness and productivity, putting one foot in front of the other.
Well,
And, it's just our life's work, all of us. Yeah. All right. Well, we're going to wrap it up. I really appreciate both of your time today to talk about your book, Navigating Autism. I encourage my listeners to go pick that up, and I'm going to be reading it. So I look forward to continuing to follow your great work. And for all the show notes, everything we mentioned today, you can go to marybarbera.com/147 for all the details. So thanks so much for your time.
well,
Thanks
thank
for
you so
having
much
us.
for having us.